Rishi Sunak apologised to thousands of people infected with contaminated blood in a decades-long scandal. This comes after reports of a 6-year-long investigation showing horrifying results. Details from the probe reveal that authorities knowingly exposed victims to unacceptable risks and even tried to cover it up. Sunak promised compensation that's expected to be above $12 billion when the government announces the package today. Inquiry Chair Brian Langstaff said more than 30,000 people received infected blood and blood products in the 1970s and 80s from Britain's state-funded National Health Service. Well, families of victims and survivors are still seeking justice even after all of these years. Langstaff, who led a near 6-year inquiry, said the scale of what happened was both horrifying and astonishing.
Were treated in hospital and at home. Tragically, the infections happened because those in authority, doctors, the blood services and successive governments, did not put patient safety first. They lost sight of what was known about the risks of viral infections from blood. Doctor knows best was such a strong belief that health departments did not issue guidance to curb the unsafe use of blood and blood products. Decision-making on measures that could make blood and blood products safer was put off, then dragged out unnecessarily, and failed to reach clear and decisive conclusions.
The infected blood inquiry concluded that more than 30,000 people were infected with viruses such as HIV and hepatitis after being given the infected blood. Victims included those needing blood transfusions for accidents and in surgery, as well as those suffering from blood disorders such as haemophilia, who were treated with donated blood plasma products. Some 3,000 people died, and more will follow. It's what's been described as the biggest treatment disaster in the 8-decade history of the state-run National Health Service. On top of the 3,000 patients who died, many more were left with lifelong health problems. In some instances, children with bleeding disorders were treated as objects for research. The report said that at one school where 122 pupils with haemophilia were given infected blood products between 1970 and 1987, only 30 survive now. Blood donors were not screened properly, and blood products were imported from abroad, including from the United States, where drug users and prisoners were used for donations. Too many transfusions were also given when they were not necessarily needed. There were even attempts to conceal the scandal, including evidence that officials in the health department destroyed documents in 1993. Well, for more on this, we're being joined by our correspondent, John Bevere, live from Bristol. John, this is a completely harrowing tale of corruption and cover-up, but give us a sense of what we heard yesterday and also what we can expect from the government today.
Yeah, well, the government being unapologetic very apologetic, I beg your pardon, in terms of what they were saying, and admitting that this was a huge cover-up and something that went drastically wrong and went wrong for many decades. So, of course, that is something the government say they're going to put right, and they're going to put it right by offering up a compensation package which will run into the billions of pounds. So the government appreciating the scale of this, but just going over some of those details that you mentioned in terms of what happened. We found out, for example, that blood products weren't being heat treated despite the HIV epidemic that had emerged, and it ran for several years of blood products not being heat treated before these transfusions were given to some of the most vulnerable people such as those who have haemophilia or those who have been in accidents as well. So people who desperately needed good treatment and they weren't getting it. So yes, we heard about the lack of heat treating to minimise the risk of HIV. We heard about the cover-ups and, as you say, documents being destroyed. And the really, I think, striking thing is that this didn't just happen in one place or one hospital or one area. This happened across the country, and it happened for many decades as well, starting from the 1970s, going all the way through until the early 90s as well. So yes, the government are saying that they will provide the compensation that's needed. I think, of course, what a lot of the victims and the victims' families, for those who have already died, they want to know what lessons can be learned so that something similar won't happen again, that there won't be this sort of institutional cover-up that we've seen. And I think it's those elements that the victims' families will be particularly keen on hearing more from the government to make sure that we don't get a repeat of this when it comes to the health service. Because as we heard there, that theory that doctor knows best, and so people just didn't question what was happening in terms of the treatment that was being given to them. And that's what enabled this to go on for so long. So there are plenty of questions about the compensation. We're going to be hearing more about that later today, but also plenty of questions about the lessons that need to be learned to stop something like this from happening again. And this report that went on for many years, the investigation into it, it really has been incredibly damning for the National Health Service and previous governments here in the UK.
Absolutely. And you mentioned the victims, John. What are those people and those families saying? What's the immediate reaction from the victims and their families to what was announced yesterday?
Well, a lot of the reaction has been welcoming what the Prime Minister had to say yesterday in terms of acknowledging the scale of this. I think there is also some vindication, because a lot of victims and victims' families, well, they have been saying that there has been an industrial level cover-up for many years, many decades, in fact. So they finally feel vindicated in terms of seeing that all laid out in black and white from the report itself. But I think really there is a sort of sadness as well in terms of what we've been hearing from victims and victims' families, because they say that this all could have been avoided if clearer measures were put in place earlier on, if doctors had responded to the threat of the HIV outbreak, just even making simple changes to how blood was treated, who blood was taken from. All of those sorts of things meant that many thousands of people would still be alive now. And as we've mentioned before, these are people who maybe received a blood transfusion because they'd had a serious accident. So these were the people who needed the best care, and they were let down in their hour of need. So I think there is a sadness about what's happened, and very much a determination that something like this won't happen again in future.
Absolutely. It's a truly shocking tale. John Bevere joining us live there from Bristol. Many thanks for your insight.